Your body is warning you. 8 signs you have too much sugar in your blood. I want to ask you something right now, and I need you to think about it honestly. When was the last time you had your blood sugar checked? Not just mentioned in passing at a routine visit, actually tested, actually discussed, actually understood. Because here is what I know from 15 years of sitting with patients over 60 in my examination room. The majority of people who have too much sugar in their blood, people who are in the pre-diabetic or early diabetic range, have absolutely no idea. They feel reasonably okay. They are going about their lives. They are eating, sleeping, working, spending time with their families, and quietly, steadily, silently, high blood sugar is damaging their blood vessels, their nerves, their kidneys, their eyes, and their heart, day after day, meal after meal, year after year, without a single obvious symptom that they recognize as a warning. The Centers for Disease Control estimates that approximately 96 million American adults, that is more than 1 in 3, have prediabetes. And of those 96 million people, more than 80% do not know they have it. 80%. Nearly 80 million Americans walking around right now with blood sugar levels that are already damaging their bodies. And they have no idea because nobody told them what to look for. Well, today I am going to tell you. My name is Dr. Sienna Black. I am an internal medicine physician with over 15 years of clinical experience working with older adults. And today I am going to walk you through 8 specific signs that your body sends when your blood sugar is too high. Signs that are real, that are happening right now in millions of Americans, and that are being missed, dismissed, and attributed to everything except the actual cause. Please stay with me for this entire video. Because by the time you reach the end, you are going to understand your body in a way you did not before. And that understanding could change everything. Before we get into the 8 signs, I want to make sure you understand what is actually happening in your body when your blood sugar is too high. Because I find that when people understand the mechanism, they take the warning signs far more seriously. Glucose, blood sugar, is your body's primary fuel source. Every cell in your body uses glucose for energy. When you eat carbohydrates, your digestive system breaks them down into glucose, which enters your bloodstream. Your pancreas responds by releasing insulin, a hormone whose job is to act like a key, unlocking your cells so glucose can enter and be used for energy. In a healthy metabolic system, this process is smooth and efficient. Blood sugar rises after a meal, insulin is released, glucose enters the cells, blood sugar returns to normal. But when you consistently consume more sugar and refined carbohydrates than your body can efficiently process, or when your cells become less responsive to insulin, a condition called insulin resistance, the system starts to break down. Glucose accumulates in the bloodstream because it cannot enter the cells efficiently. Your pancreas works harder and harder, pumping out more and more insulin in an attempt to overcome the resistance. For a while this compensates, but over time the pancreas cannot keep up. Blood sugar levels remain persistently elevated, and that persistent elevation, that chronic excess of glucose in the bloodstream, begins to damage the body through multiple mechanisms simultaneously. It damages blood vessel walls through a process called glycation, where glucose molecules attach to proteins in the vessel walls, making them stiff and prone to inflammation. It damages the small blood vessels that supply nerves, eyes, and kidneys. It promotes chronic systemic inflammation, it accelerates atherosclerosis, and it creates the conditions for the full constellation of diabetic complications, kidney disease, neuropathy, retinopathy, cardiovascular disease, that make uncontrolled diabetes one of the most destructive chronic conditions in American medicine. After 60, this process is even more dangerous because aging naturally reduces insulin sensitivity, meaning the same dietary patterns that were manageable at 40 can push blood sugar into dangerous territory at 65. So knowing the 8 warning signs is not just useful. For someone over 60, it is genuinely urgent. Sign number 1 is frequent urination, particularly at night. If you are getting up 2, 3, 4, or more times during the night to urinate, and this represents a change from your previous pattern, high blood sugar is one of the most important causes to consider. Here is the mechanism. When blood sugar rises above a certain threshold, approximately 180 milligrams per deciliter, the kidneys begin to spill excess glucose into the urine in an attempt to clear it from the bloodstream. But glucose in the kidney tubules acts osmotically. It draws water with it as it is excreted. The result is dramatically increased urine production. Your body is essentially using urine to dump the excess sugar it cannot process. This increased urine production leads to frequent urination throughout the day and especially at night, a condition called nocturia, when the kidneys continue their glucose clearing work even as you are trying to sleep. Many people attribute nighttime urination to aging, to prostate issues in men, to bladder changes in women. And sometimes it is those things. But when nighttime urination is new, when it is combined with other signs I am going to describe, when it has been gradually worsening over weeks or months, blood sugar testing is essential. Sign number 2 is extreme thirst that water does not seem to fully satisfy. This follows directly from sign number 1. When your kidneys are producing excess urine to clear glucose from your blood, you are losing significantly more fluid than normal. Your body responds to this fluid loss with intense thirst, a physiological signal to replace the water that is being lost through excessive urination. Patients describe this thirst as different from ordinary thirst. It is persistent. It returns quickly even after drinking. It has a quality of urgency that feels almost unquenchable. You drink a large glass of water and 20 minutes later you are thirsty again. This combination of excessive thirst and excessive urination, what physicians call polydipsia and polyuria, is one of the classic symptom pairs of high blood sugar and has been recognized as a sign of diabetes for literally thousands of years. If you find yourself drinking far more fluid than you used to and still feeling persistently thirsty, particularly in combination with the other signs in this video, please get your blood sugar tested as soon as possible. Sign number 3 is unexpected and unintended weight loss. Now I know that in our culture, weight loss is almost universally celebrated. But unexplained weight loss when you are not trying to lose weight and have not changed your eating habits is a warning sign that should never be dismissed. Here is why it happens with high blood sugar. When cells cannot access glucose properly due to insulin resistance, they are essentially starving for energy. Even though there is plenty of glucose in the bloodstream just outside them, the body responds to this cellular starvation by breaking down alternative fuel sources, first fat stores, then muscle tissue, to meet its energy needs. The result is weight loss that occurs despite normal or even increased food intake. Patients are sometimes initially pleased by unexplained weight loss before they understand its cause. But this kind of weight loss is accompanied by weakness, fatigue, and muscle wasting that is deeply harmful. And it signals that the metabolic disruption of high blood sugar has reached a significant level. If you have lost more than 5 to 10 pounds over the past few months without intentional dietary changes or increased exercise, particularly if you are also experiencing thirst, frequent urination, and fatigue, please seek medical evaluation urgently. Sign number 4 is extreme fatigue, and like the liver-related and kidney-related fatigue we have discussed in previous videos on this channel, the fatigue of high blood sugar has specific characteristics that distinguish it from ordinary tiredness. When cells cannot efficiently access glucose for energy because of insulin resistance or because insulin production is declining, every cell in the body is running on less fuel than it needs. The result is a pervasive whole-body exhaustion that is not relieved by sleep. Patients describe feeling heavy, slow, mentally foggy, and physically drained even after a full night of rest. Simple tasks require disproportionate effort. Concentration is difficult. The brain, which is extraordinarily dependent on steady glucose for function, becomes foggy and slow when glucose metabolism is disrupted. This cognitive fog component of high blood sugar fatigue is particularly important to recognize in adults over 60 because it can be mistakenly attributed to normal aging or even early dementia when the actual cause is a metabolic condition that can be tested for and treated. If your fatigue is accompanied by mental fogginess, difficulty concentrating, and a slowness of thought that is new or worsening, blood sugar should be on the diagnostic list. Sign number 5 is blurred vision. The lens of the eye is sensitive to changes in fluid balance, and when blood sugar is elevated, the increased fluid in the bloodstream causes the lens to swell slightly, changing its shape and therefore its ability to focus light correctly. The result is blurring of vision that can fluctuate, sometimes worse, sometimes better, depending on how much blood sugar has risen at any given time. This is different from the gradual vision changes of aging or the development of cataracts. It tends to be more acute, more variable, and more closely associated with dietary patterns, often worse after high carbohydrate meals when blood sugar spikes most dramatically. Beyond this acute lens effect, chronic high blood sugar causes serious long-term damage to the tiny blood vessels in the retina, the light-sensitive tissue at the back of the eye, a condition called diabetic retinopathy, which is the leading cause of blindness in American adults. Early retinopathy produces no symptoms at all. It is only detectable through a dilated eye examination. By the time vision changes are noticeable, significant damage has often already occurred. So any new blurring of vision, particularly if it fluctuates, particularly if it occurs alongside other signs on this list, warrants both blood sugar testing and an eye examination. Sign number 6 is slow healing wounds and frequent infections. Glucose is the primary food source not just for your cells, but for bacteria and fungi as well. When blood sugar is elevated, your tissues are literally bathed in a sugar-rich environment that promotes the growth of infectious organisms. At the same time, high blood sugar impairs the function of the white blood cells that form the front line of your immune defense, reducing their ability to detect, pursue, and destroy invading bacteria and fungi. The combination of a sugar-rich environment that promotes microbial growth and an impaired immune response creates the conditions for frequent, persistent, and unusually severe infections. Urinary tract infections that recur repeatedly, skin infections that develop from minor cuts or scratches, fungal infections, particularly in warm, moist areas of the body, that are resistant to standard treatment, gum infections and periodontal disease that progress unusually quickly, and wounds, even small ones, that simply refuse to heal at a normal rate. The circulatory impairment that develops with chronic high blood sugar also reduces blood flow to the extremities, particularly the feet, depriving wounds of the oxygen and nutrients they need to heal. This is the beginning of the pathway that in advanced uncontrolled diabetes can lead to non-healing foot ulcers and in severe cases, amputation. Recognizing slow wound healing and frequent infections as potential signs of high blood sugar, rather than simply treating each infection as an isolated event, is critically important for anyone over 60. Sign number 7 is tingling, numbness, or burning in the hands and feet, and this sign represents nerve damage that has already begun. As we discussed in our video about nighttime leg symptoms, peripheral neuropathy, damage to the peripheral nerves, is one of the most common and serious complications of chronic high blood sugar. The small blood vessels that supply oxygen and nutrients to the peripheral nerves are among the first structures to be damaged by chronically elevated glucose. As those vessels are damaged, the nerves they supply begin to malfunction. In the early stages, this produces the tingling, pins, and needles, or burning sensations that patients most commonly notice in the feet, though hands can be affected as well. These sensations are often worse at night. They may come and go initially, but tend to become more consistent over time as the nerve damage progresses. In later stages, the tingling and burning may be replaced by numbness, a loss of sensation that is in some ways even more dangerous because it means you can injure your feet without knowing it. A blister, a cut, a pressure sore, undetected because the sensation that would normally alert you to it is gone, can become a serious infected wound before you even know it exists. If you are experiencing new or worsening tingling, burning, or numbness in your feet or hands, particularly if you have other signs from this list, please get your blood sugar tested immediately. Neuropathy from high blood sugar can be halted and in some cases partially reversed if the underlying blood sugar problem is identified and treated early. But nerve damage that is allowed to progress for years is largely irreversible. Sign number 8 is dark patches of skin, specifically a velvety, darkened thickening of the skin in the folds and creases of the body, the back of the neck, the armpits, the groin, the skin under the breasts, and the inner thighs. This condition is called acanthosis nigricans, and it is one of the most direct visible signs of insulin resistance. It occurs because elevated insulin levels in the bloodstream stimulate the growth of skin cells in these friction-prone areas, causing them to thicken and darken. Patients often mistake it for dirt that will not wash off, or for a skin condition caused by friction, or simply for a change in pigmentation that is part of aging. Some people are embarrassed by it and try to scrub it away. But acanthosis nigricans is not a skin problem. It is a metabolic signal. It is your skin literally showing you that your insulin levels are chronically elevated and that your cells are becoming resistant to insulin's action. In adults over 60 who are overweight or have a family history of diabetes, acanthosis nigricans should prompt immediate blood sugar testing because it often precedes the development of overt diabetes by years, representing a window during which intervention can prevent full diabetes from developing. So here are your 8 signs together. Frequent urination, especially at night, extreme thirst that water does not satisfy, unexplained weight loss without dietary changes, profound fatigue and mental fog that sleep does not fix, blurred vision that fluctuates, slow healing wounds and frequent infections, tingling, burning, or numbness in the feet and hands, and dark velvety patches of skin in body folds and creases. If you are experiencing 2 or more of these signs, please do not wait for your next scheduled physical. Call your doctor this week and ask specifically for a fasting blood glucose test and a hemoglobin A1C. The A1C test is particularly valuable because it gives a 3-month average of your blood sugar levels. It cannot be influenced by what you ate yesterday or whether you fasted this morning. It tells the true story of what your blood sugar has been doing over time. These tests are simple, inexpensive, and widely available, and they can reveal a blood sugar problem that has been developing silently for years, at a stage where it is still highly manageable. I want to tell you about my patient James. 67 years old, retired firefighter, came to see me because his wife insisted. He had been getting up 3 times a night to urinate for almost a year. He had been drinking enormous amounts of water and still feeling thirsty. He had lost 12 pounds without trying. He had been having tingling in his feet that he thought was from years of wearing heavy boots on the job. He had a cut on his foot that had been healing slowly for 6 weeks. He had never connected these symptoms. He thought the urination was his prostate, the weight loss was stress, the tingling was old injuries, the thirst was just the dry air. His A1C came back at 9.2, well into the diabetic range. His blood sugar had been severely elevated for what we estimated was at least 2 to 3 years. We began treatment immediately. Dietary changes, medication, close monitoring. Within 6 months, his A1C was down to 6.8. The tingling in his feet improved. The wound healed. He started sleeping through the night. But the 2 to 3 years of uncontrolled high blood sugar had already left some permanent damage to his kidneys and his peripheral nerves that will require ongoing management. James told me, "I had no idea all those things were connected. I thought I was just getting old." And that is the sentence I hear most often in my practice. I thought I was just getting old. You are not just getting old. Your body is sending you messages, and now you know how to read them. I am Dr. Sienna Black. Please share this video with someone you love who needs to hear it. Subscribe to Healthy After 60. Hit the like button if this helped you today, and I will see you in the next video. Take care of yourself. Your blood sugar is worth checking. Do not wait another day. Before I close today, I want to spend some time on what you should actually do if your tests come back showing elevated blood sugar. Because getting a diagnosis is not the end of the conversation, it is the beginning of one. And I want to make sure you walk away from this video not just knowing the warning signs, but knowing what comes next if those warning signs turn out to be real. If your fasting blood glucose comes back between 100 and 125 milligrams per deciliter, or your A1C comes back between 5.7 and 6.4%, you are in the prediabetes range. This is not a diagnosis of diabetes. This is a warning, a yellow light, a clear signal that your blood sugar regulation is becoming impaired and that without meaningful intervention, full type 2 diabetes is likely in the coming years. But here is what I want you to understand about prediabetes. It is not inevitable that prediabetes becomes diabetes. The landmark Diabetes Prevention Program study, one of the most important clinical trials in American medical history, demonstrated that lifestyle intervention in people with prediabetes reduced the progression to type 2 diabetes by 58%. 58%, with no medication, just dietary changes, increased physical activity, and modest weight loss. In people over 60, the results were even more impressive, showing a 71% reduction in progression to diabetes with lifestyle intervention. 71%. That means that if you are over 60 and you find out you have prediabetes today, and you commit to making meaningful lifestyle changes, there is an excellent chance you never develop full diabetes at all. That is an extraordinary opportunity, and it is available only to people who know their blood sugar status, which is exactly why getting tested matters so much. If your results come back showing full type 2 diabetes, an A1C of 6.5% or higher, or a fasting glucose of 126 or above, I want you to hear this clearly. This is serious, but it is not a death sentence. It is not the end of a good life. It is a diagnosis that requires active management, but that millions of Americans are managing successfully every day. The most important thing you can do immediately is work with your doctor to develop a treatment plan that includes dietary modification, physical activity goals, blood sugar monitoring, and potentially medication. Do not try to manage this alone with internet advice and supplements. Diabetes management has become genuinely sophisticated in recent years. There are excellent medications, excellent monitoring tools, and excellent support systems available, but they require a physician's guidance to use safely and effectively. What I want to emphasize most strongly is the dietary component, because food is the most direct lever you have on your blood sugar. Reducing refined carbohydrates and added sugars, the white bread, white rice, sugary drinks, processed snack foods, and sweetened breakfast foods that drive blood sugar spikes is the single most impactful dietary change most people can make. Increasing fiber intake from vegetables, legumes, and whole grains slows glucose absorption and reduces blood sugar spikes. Choosing proteins and healthy fats alongside carbohydrates at every meal reduces the glycemic impact of the meal overall. Reducing portion sizes, particularly of starchy foods, allows more moderate blood sugar responses. These are not temporary measures to follow until you feel better. They are the ongoing foundation of blood sugar management that, combined with appropriate medication when needed, can keep your blood sugar controlled and your complications minimized for the rest of your life. I also want to talk about the monitoring piece, because many of my patients are confused about how often and when they should be testing their blood sugar if they have been diagnosed with prediabetes or diabetes. The specifics of monitoring frequency should be determined with your doctor based on your individual situation and treatment plan. But I want to give you a general framework. For people with prediabetes who are managing through lifestyle alone, checking a fasting blood glucose periodically, and getting an A1C every 3 to 6 months gives a good picture of how your efforts are working. For people with type 2 diabetes managed with oral medications, your doctor will likely recommend checking your blood sugar at specific times, often fasting in the morning and sometimes 2 hours after meals, to understand how your body is responding to food and medication. For people on insulin, monitoring is more frequent and more critical, and your doctor will give you specific guidance. The important thing is that monitoring gives you information, and information gives you power. Seeing your blood sugar respond to a specific meal, or drop with a 20-minute walk, or improve over months of dietary discipline, that feedback is motivating and empowering in a way that simply taking a medication and hoping for the best is not. Engage with your numbers, learn from them, use them to guide your choices. They are not a report card or a judgment, they are data. And data helps you make better decisions every single day. There is one final thought I want to leave you with today, and it is something I believe deeply after 15 years of watching patients navigate chronic disease. The single most important variable in how well any chronic condition is managed is not the medication, not the technology, not the access to the best specialists, though all of those things matter. The most important variable is the patient's understanding of their own condition. Patients who truly understand what high blood sugar is doing to their body, who can picture the glycation of their blood vessels, who understand why their kidneys are at risk, why their nerve endings are vulnerable, why their immune system is compromised. Those patients make different choices. They check their blood sugar, they think about their food, they take their medications consistently, they come back to their appointments, not because they are more disciplined or more motivated by nature, but because they understand the stakes. And understanding the stakes changes everything. Today, I have given you 8 signs to watch for and a framework for understanding what high blood sugar is doing inside your body. Use that understanding. Let it guide your choices. Let it motivate you to pick up the phone and make the appointment. Let it be the reason you ask your doctor for the A1C test at your next visit. Your body has been sending you messages. Now you know how to read them. I am Dr. Sienna Black. I will see you in the next video. Take good care of yourself. You deserve to feel well for every year ahead of you.